So in this video, we're going to talk about the various techniques that you can expect coming into a chiropractic office. There's a lot of anxiety that I've seen over the years about coming in for their first visit. There are techniques that we use where we actually do some manual adjusting on patients, where we'll actually lay them on the table, and with a very gentle thrust, we actually try to move a vertebrae into its proper alignment and restore movement to that joint. But some patients really honestly can't handle that type of manipulative type of care. So in those cases, patients with, say, osteoporosis, elderly patients, or quite frankly, patients that are just not, they just can't ease their concerns about having something moving, we actually move to different techniques that are very gentle and very effective. We actually have used these on children and the elderly, like we mentioned to you. So some of the techniques we can actually use, we can talk more about a little bit later about the manual adjusting, but over here I like to actually show you some different instruments that we have used. They all look a little scary at first, but they're really not. This instrument right here is called an activator, and this activator is a very gentle, we call it high velocity type of instrument that we can use to direct at certain parts of the spine to actually give the desired movement that we're looking for. And so often we'll use this instrument on elderly patients like I've mentioned, and children. Other than this making a lot of noise and being a little dramatic, it's a very effective, very gentle type of technique. Sometimes we'll use certain things called SOT blocks. It's called the sacral occipital technique. These blocks are used for pelvic dysfunction, which we will talk about in a later video. But using this with an assist of the table to help to give the desired movement that we're looking for in the pelvis can be very effective. We also have an instrument here which is great for muscular tightness. It's called the vibrocussor, and patients honestly would steal this from me and take it if they could. It's a very special technique we use to actually help loosen muscles around the shoulders and the back. It's a great way to help kind of loosen up tight muscle tissue and bring blood back into the area. It's actually based on percussion, not vibration, which is a very effective tool for resetting muscle fibers and tension in the muscles. And then this instrument over here, again, is another adjusting tool we have used over the years, which is a very effective tool in actually restoring the cervical curve. It's a very gentle tool in delivering very fast impulses in certain areas of the spine. Again, I've used this on children and elderly patients, and is very quite effective. And all this, it comes back to evaluating you when you first come in for your first visit. You know, the reason for the first visit is honestly to determine what technique is going to be safe for you. We need to identify if chiropractic is the right care for you. We need to identify what areas in your spine need to be effective. And so I hope that this video helps to address some of the concerns you may have. And I ask you, when you first come in for your first visit, share with me your concerns. We like to try to make any technique available for you, and we don't want patients to come in here being fearful for what we're going to be doing for them. 90-something% of my patients walk out of here very happy with what they get here, and our job is to be as efficient as possible, but very effective and not as aggressive as you may hear from other offices. We thank you for your time.